A 24-year-old woman presents to the emergency department with a 3-day history of joint pain and swelling, which began in her right knee and has since spread to her left ankle and wrist. She also reports experiencing fever, chills, and a rash on her forearms and lower legs. Her medical history is unremarkable, and she is sexually active with multiple partners but does not consistently use barrier protection. On physical examination, she has tenderness and swelling in the affected joints, with pain on passive extension of the fingers, tenosynovitis. There are several small, erythematous papules on her extremities. Which of the following is the most likely diagnosis? A. Rheumatic fever. B. Reactive arthritis. C. Disseminated gonococcal infection. D. Systemic lupus erythematosus. E. Lyme disease. Please pause and write your answer in the comments. Now let's find the correct answer. Answer. C. Disseminated gonococcal infection. Explanation. Disseminated gonococcal infection, DGI, should be considered in young, sexually active patients presenting with asymmetric polyarthralgias, tenosynovitis, and a rash. Neisseria gonorrhoeae is the most common cause of septic arthritis in this population. The diagnosis is confirmed by a combination of gram stain of synovial fluid, blood cultures, and nucleic acid amplification tests, NAAT, from genital or pharyngeal sites. Why not the other options? A. Rheumatic fever typically follows a streptococcal throat infection and presents with migratory arthritis, carditis, and other systemic features, but it does not usually involve tenosynovitis or a rash like DGI. B. Reactive arthritis, associated with a preceding infection, particularly gastrointestinal or genitourinary, but it is less likely to present with the characteristic rash and tenosynovitis seen in DGI. D. Systemic lupus erythematosus, can cause polyarthritis and a rash, but the distribution of the rash and joint involvement differs from the typical presentation of DGI. E. Lyme disease. Lyme disease can cause migratory arthritis, but it typically presents with a history of tick exposure and erythema migrans, rather than the systemic symptoms and tenosynovitis seen in DGI. Key takeaway: disseminated gonococcal infection is the leading cause of septic arthritis in young, sexually active patients and should be suspected when patients present with asymmetric polyarthralgias, tenosynovitis, and a characteristic rash. If you loved this video, please like and hit the subscribe button. We will keep uploading new questions on a regular basis.